Good evening, good afternoon, or good morning. My name is LaShonda Davis, and I am a member of the NAACP Health Committee, Richmond, California branch. Welcome to our web series, COVID Conversations. This evening, we'll be in conversation with Dr. Nathan Allen. It is a pleasure to have you, Dr. Allen. Please take a moment to introduce yourself.
But I grew up in Richmond and went to high school and junior college in Richmond at Contra Costa Junior College. Went to UC Davis to finish my undergraduate studies and liked it so much I stayed there for medical school, which was a good experience at Davis. After that, I trained at Martin Luther King, MLK Hospital, Charles Drew Postgraduate Medical School in Los Angeles, and obstetrics and gynecology. And I've been here in Sacramento ever since. I came here in 1981, and it's been a very fruitful experience for me, very good experience for me. Again, I'm an obstetrician gynecologist. I'm Director of Women's Health for FQHC. That's a federally qualified health clinic called WellSpace here in Sacramento. And our primary, we've got several thousand patients, and we have a mixture of everybody: Hispanics, African Americans, whites, Caucasians, lots of Asians. We just have a good mixture of patients, and mostly all of them are Medi-Cal patients. So, and that's what I do.
All right. Thank you. Again, it is a pleasure and an honor to have you and be in conversation with you for our COVID conversations. So as usual, I field questions from the community so that we can get their questions answered. So this evening, this morning, this afternoon, you will be answering questions that I have taken from folks who are either pregnant or are thinking about getting pregnant, or their family members are concerned about COVID-19 vaccination and pregnancy. So let's start with the first question. This questioner says, I am hesitant about getting the vaccine because I heard that it would make women infertile. Is that true?
That is blatantly false. On the fact checks, yeah, that is false. There's no evidence whatsoever anywhere around the world. And I keep up with the literature and also the CDC literature. There's no evidence whatsoever that it makes men or women infertile, and it doesn't make men sterile. I think there's an entertainer that said her cousin or a cousin of hers or a friend of a cousin of hers had gotten sterile from getting the vaccine. What's her name? Minaj. Yeah, that's late. That's, in fact, I think she walked that back because, that story that she told was not true. There's no evidence whatsoever that women become infertile and that men become sterile.
Okay. Is there any reason why that would enter into the conversation with the vaccine that's given in your arm? Can you make the connection of why folks would even have that understanding of impetuosity with the COVID-19 vaccine?
Just misinformation on the internet. People hear it on the internet, they see it on the internet, and it becomes true. It becomes doctrine. If you can't believe it on the internet, who can you believe? People, I get a lot of questions in my office. I said, where'd you hear that from? They said, I did my research. I said, where? On the internet. I saw it on the internet, some site. I mean, is this a site that's been vetted? I don't know. It's just something that I saw on the internet. And again, they see it on the internet. It must be true.
Gotcha. All right. Thank you. And the
Yeah.
next question. So this person says, I am thinking about getting pregnant within the next few months.
Mhm.
Should I get the COVID-19 vaccine?
Oh, absolutely. The American College of Obstetrics and Gynecology, which I'm a member of, American Pediatric Society, the CDC, all medical groups, American Medical Association, all suggest that you get pregnant, that you get vaccinated, no matter what stage of pregnancy. If you're going to be pregnant, if you are pregnant, we all recommend the vaccine.
Okay.
Because if you're pregnant and you get the COVID, your chances of getting sick, having respiratory illness, a severe respiratory distress syndrome, is quite a bit greater than the general population. For some reason, it hits pregnant women very hard. I've got I work at two hospitals, and one hospital, Sutter Memorial, I've hired people to work in the hospital 24/7. And about a month ago, I asked one of the docs I have in the hospital how things going. He says, "Oh, it feels like I'm running a COVID unit up here because there's so many pregnant women in the hospital in the ICU behind COVID." I'm sure and the experience in the Bay Area is the same as it is up here. It's just something that happens, and it's deadly. We've had several women die of COVID, pregnant women that have died of COVID. I had a pregnant woman. This woman has been my patient, for at least 30 years or so. And she was 59. And her daughter has been my patient for maybe 15 years. I've delivered her babies. In fact, I delivered her. And I ask all my patients when they come in, are you vaccinated? And some say yes, some say no, but they ask me, should they? But anyway, this person didn't ask me. But she came in to the hospital. She had been to a party at her aunt's house, a family gathering at her aunt's house, at her mother's sister's house, the two of them. And she says there were people that were sick there, sniffles, fevers, and all that kind of stuff. They didn't think anything of it. They went home, and on Saturday, 2 days later, they were admitted to the hospital because they couldn't breathe. They were having shortness of breath, fever, just weren't feeling well. And so her and her mother went in together. They went to the emergency room, and the hospital admitted both of them because of those symptoms that they had. And I didn't hear about this until the following Tuesday. 4 days later, Wednesday, she came into the office, kind of like crying. I said, "What's up?" And she was saying, well, she told me the story about the gathering they went to. And she was saying that both of them went in. Her mother and her both went in. Her mother died 2 days later, and she got sick. She was sick, but she was too distraught to stay in the hospital. So they sent her home with oxygen because she wasn't as affected as her mother was, but she had symptoms. And I guess about 2 weeks later, I did a C-section on her because she still had symptoms, and she wasn't feeling much better. So, I said, let's just do this. And, if you're not pregnant, maybe you'll get better sooner. So, yeah, that's a true story. It's just really hit me hard because, as I was saying, she had been my patient. Her mother had for at least 30 some years. And their plan, they talked about this beforehand, and their plan was that they would both go in and get the vaccine after she had her baby. And now she says she wishes they just would have done it, but they had heard so much about the negative effects of getting from the internet, the negative effects of getting the vaccine. And so she decided, her and her mother decided to wait. Of course, she's sorry for that decision, but that's life. True story.
Okay. Wow. That's tough.
And I've got other patients that, I mean, many patients, if not just a few, many patients that can't come into the office for 14 days because they tested positive for COVID. Now, most of them didn't get severely sick, but I asked them, well, how are you feeling? I'm coughing. I've got a fever, and I just don't feel well. My sense of taste is gone, and they just feel weak. And so we don't allow them to come into the office if they got COVID symptoms or they've tested positive for COVID until they're 10 days afterwards, or for ones with symptoms for 10 days afterwards. And then they have to test negative for 3 days before we let them come into the office. But a lot of patients, they don't have severe symptoms. A lot do, but a lot of patients don't. But still, they can't come in. I'm doing more televisits than I have in a long time because of they can't come in, but I need to talk to them. They need to talk them in, let me know what's going on with them, so I can suggest that they go into the hospital, or if you got fever, take some Tylenol, get your temperature down.
Okay, all right, that is really good information. So, Dr. Allen, this question: how is the COVID-19 vaccine different from other vaccines I've had in the past?
Well, this is the first vaccine that was, excuse me for a second. Yeah. So this was the first vaccine that used messenger RNA. Other vaccines have used live viruses or particles from inactivated viruses to develop antibodies, to give patients and to develop antibodies. But the messenger RNA is different because what it does is how it was developed and how it's administered is again, they use some messenger mRNA, which is it's in a capsule. It's encapsulated by a nanoparticle, and what it does, it delivers by it's being encapsulated. It's delivered by injection, and it's delivered into the host cells. The encapsulation allows it to be delivered to the host cells. The cells of a woman's body causes your antibody to develop a spike, and the spike is what can create antibodies against COVID-19. And again, it's not a live virus. It's one of the developments of when SARS. Okay, SARS was a vaccine that they used, that they developed using the mRNA, messenger mRNA. They developed the SARS, and they kind of use the same platform, except for they tweaked it so that it will allow the host the person getting the vaccine to develop these antibodies, which is 94 to 98% effective in protecting you against the virus.